Okay. So what I'd like to talk to you about today is body composition of soldiers and its interrelationships with physical fitness, injury risk, and deployments. Let's see if this is just your standard disclaimer as everybody's had. What I'd like to do today is use recent Army data to illustrate the complexity of the interrelationships between BMI, percent body fat, physical fitness, and injury risks, and also to examine some of the effects of deployment on body composition and fitness. These are some guiding questions that I'd like to try and address to you. The first one is, what are the correlations of BMI with physical fitness and injury risks among soldiers? The second one is, what are the correlations of BMI with the components of physical fitness and military task performance? Followed by, what is the effect of deployment to areas of combat on body composition and fitness? And then finally, what can we conclude from the data you will have seen? First, we'll look at BMI, physical fitness, and injury risks among Army recruits. Some of these slides are fairly complex, so I'm going to try and lead you to what I think the major points are. What we see here in this slide is body mass index and injury risks for men and women in basic combat training. And what we see along the horizontal axis is body mass index from low to high and injury risks on the vertical column. And what we see here is that injury risks are a slightly bimodal curve in this population of 41,000 women and about 143,000 men. The high points are at the extremes, and the middle is low for both men and women. Women ranging from about 39% up to 41 or 42% at the outside, and for men, a low of 14.4% injured during the 10 weeks of basic training in the middle, and at the extreme 16 and 18%. This is probably the most consistent finding that we have seen over a 30 or 40-year period of research since the 1980s. And what we see here is aerobic endurance fitness is measured by 2-mile run times versus injury risks. Versus injury risks on the vertical column. As we go from the fastest quintile, or 20%, to the slowest quintile, we see that for both men and women, the risks increase steadily. For men, from about 10% to over 24%. For women, from about 27% to 56%. So more than doubling of risk as we go from the fastest to the slowest. So we know that there's a relationship between BMI and runtime. So we wanted to know what would happen if we stratified risk on runtime. So what we see here is the incidence of injury as percent per 10 weeks of training for women in basic combat training. And we've stratified the risk on both 2-mile run times and BMI. So on the horizontal axis, we see run times from fastest to slowest. And on the axis coming out, we see coming from the back, the lowest BMI to the highest BMI. And what's interesting here is that the highest risk is among the leanest women with the slowest run times. And across all levels of fitness, the highest risk is in the women who are the leanest. And paradoxically, the lowest risks are in the highest 3 quintiles of BMI who ran the fastest. This is the same graphic for men, 141,000 men. The previous, or 143,000 men. The previous slide was 41,000 women. But we see basically the same thing: highest risk among the leanest, slowest men, and the lowest risk among the highest BMIs who also ran the fastest. This is just a summary of what you just saw. What I'd like to do now is move on to look at BMI, physical fitness, and age of soldiers in operational units. In basic training, all the trainees are relatively young, in their early 20s, whereas in operational units, age becomes a factor. And what we see here is that in this unit, this is a chemical brigade, but we've seen the same thing now in 2 brigades of infantry. As we go from less than 24 years to over 36 years, we see that BMI goes up progressively from 25.4 to 27.2, and average 2-mile run times for these year groups go up from 14.4 minutes to 15.6 minutes. Not unsurprisingly, as run times get slower, going from about 14 minutes or 13 minutes, 13.9 minutes to 15.9 minutes, BMI goes up from 24.5 to 27.9. So what happens if we stratify risk of injury in these active duty soldiers by BMI and age? If we look along the horizontal axis at the bottom of the marginal totals, we see that as years go up from 24 to over 36, risks of injury go up from 38 to 45 to 52 to 58%. And if we look on the vertical axis, as we go from a low BMI of less than 23.9 to over 29, risks go from 43 to 43 to 46% to 60%. So a big jump, a 50% increase in risk as we go up in body fat. Now what we're looking at is the same group of male soldiers stratified on BMI and run time. If we look across the bottom marginal totals, we see that risks in this group go up from 37 to 38 to 47 to 58%. And as BMI goes up from less than 23.9 or 29.1 from 42 to 57%. So a steep increase for the highest quintile. And what's notable is that the highest risks are concentrated in individuals who are in the higher BMI groups and run slower, and also in this group that we don't look at too often of low BMI and slow run times. Just another summary of what you've just seen. So now what I'd like to do is look at the correlations between BMI and height with physical fitness and military performance. The next series of slides will be structured in a very similar way. Along the horizontal axis, we see BMI tertiles from low to high, so in 33% increments from low to high. For men, the average BMI for the lowest tertile was 22.2, rising to 28.8 for the highest, and for women from 20.4 to 26.7. So what do we see when we look at BMI and fitness? Not unsurprisingly, what we see here is BMI versus aero performance as measured by the APFT 2-mile run time, and we see that as BMI gets higher, run times get slower for both men and women. If we look at muscle endurance as measured by bench press reps to failure with a 65-pound bar, there's not much difference for women, but muscle endurance increases in terms of number of reps for men. If we look at muscle strength of the upper body here measured by a bench press, 1 repetition maximum in pounds, we see that for both men and women, strength increases for men about from 175 pounds to almost 230 pounds, and for women from about 80 pounds to over 100. Looking at lower body strength as measured by a deadlift, 1 repetition maximum, we see similar trends of increasing strength with increasing BMI. Interestingly, however, if we look at BMI versus overall combat readiness as measured by time to complete a warrior task and battle drill obstacle course with a fighting load, times range from 10 minutes to as much as 20. We see no difference across levels of BMI, suggesting that getting through the obstacle course is a combination of muscle strength, muscle endurance, and aerobic endurance. What I'd like to do is look at height for just a moment, because the picture is a little different with height. So we go from short men and women to tall men and women in tertiles, 33% increments. For men, average height went from 67.5 inches, 5'7" or so, up to 73 inches, just a little over 6'1". For women, from 61.7 inches on average to 68.7 inches. And what we saw in the Warrior Task Battle Drill Obstacle Course was that as height went up, run times got better. For men, there was about a minute improvement for the tallest group, but for women, height seemed to be particularly important, with significantly, highly significantly faster times for the taller women. This is just a summary of what you just saw. So now what I'd like to do is move on to the effects of deployment on body composition and physical fitness. And it's not exactly what you would think. If we look, height remained the same between pre and post deployment, as you would imagine. However, body weight in this group of individuals who deployed for 9 months to Afghanistan, their weight increased from 176 to 179 pounds, a 3-pound increase. BMI increased significantly from 25.4 to 25.9. On the other hand, physical fitness as measured by push-ups, sit-ups, 2-mile run, and overall scores did not change pre to post in this population. We saw a little different picture in this group of male soldiers who deployed to Iraq for 13 months. And what we see here is height again remains same. Body weight increased from 76.6 kilograms now to 78.8 kilograms, about a 3% increase. BMI increased from 25.3 to 26.0. And percent body fat increased 4% from 18.9% to 19.9%. And several measures of muscle strength and endurance, or power rather, bench press strength, squat strength, increased 7 to 8%. And a power throw with a medicine ball from a bench increased almost 9%. So that gets us back to our guiding questions, of which there were 4. So in answer to the first question, what we saw was that the highest risks are among men and women with the lowest BMIs and the slowest run times, and the lowest risks were, oddly enough, in the highest BMI groups who ran the fastest, or in the fastest 20%. In regards to high BMI, we also saw that there was a correlation with high BMI and lower aerobic fitness, not unsurprisingly, but also higher muscle endurance and muscle strength. And we also saw that taller height is associated with better performance of military tasks, especially among women. In terms of deployment, post-deployment, we saw the percent body fat and BMI in recent deployments increased, and post-deployment muscle strength and muscle endurance appeared to stay the same or increase a little bit, which gets me to my conclusion, which is that thinking that increased BMI is associated with decreased military readiness may be misleading, since soldiers with higher BMIs and higher fitness have shown greater musculoskeletal resilience in terms of being less injury prone. And we need to keep in mind that injuries are the leading medical cause for medical non-readiness. And so if the Army desires the most physically ready soldiers, they may need standards that take into consideration both physical fitness and body composition simultaneously. And that's my presentation.